The nature of what we do is just fraught with challenges.
You have to work with different personalities, doctors, respiratory therapy, different acuity of patients.
Sometimes when you come in as a float, they have their different flows in the different clinics. Those kind of things are maybe the toughest moments I had at UC Davis, but we were able to work those out as soon as I showed the other workers that I'm just willing to do whatever it takes to show me where you want me to show up at.
The multitasking in high stress situations and trying to meet the needs of everyone at the same time.
We recently had a patient who gave birth in the field, came to the emergency department with a very, very premature infant. Because of the policies that we've established and the training and the education that the nurses had, they were able to resuscitate that baby.
The emotional aspect of nursing is probably one of the most challenging parts of our job.
When I was a new nurse at 22, I worked in a unit where there was a lot of young people suffering, chronic illness, HIV, cystic fibrosis, things like that, where they were my age and they were suffering. So just learning to be there with people when they're having a really hard time, and it doesn't feel fair that I'm healthy and you're not, but instead of focusing on that, it was like, well, how can I be there for that person?
The challenges of dealing with patients who have social issues. It's working together with our physicians, our social services, to try and make sure that these patients get the same care as everybody else.
We have no control over how many people want to check in on a daily basis or need to be there. We have people coming in our front door, people coming in our ambulance bays. Our leadership saw how we were struggling and helped work with our teams at the bedside so that we could have a workflow that keeps us safe and keeps our patients safe.
There could be patients or families who have never been to the hospital before. Even if the patient is my patient, I know that nurses are available for me, so then I can ask, hey, can you help me and maybe talk to the parents and just explain what's going on?
For my cohort in nursing, it would be the pandemic, the COVID-19 pandemic.
Everything shut down, so our lives looked a little different as far as how we were going to deliver that patient care. Everybody came together, from doctors and social workers and the nursing staff, coming together and talking about how we're going to still provide that critical care to our patients.
It was kind of cool to be a part of history and be one of the first people that took the vaccine, but felt proud then, like service to the country and to the people that we were there.
Not every day is a good day when you're a nurse, but when you look at the bigger picture, it is extremely rewarding.
This university in particular does a really good job at identifying challenges and trying to figure out a way to overcome them.
It may be difficult, but we eventually get to where we need.
I try to always do my best for every single patient, every single time.